Manic depressive psychosis. What is manic depressive psychosis? The manic depressive psychosis is also called as bipolar disorder, where it is a psychological disorder where there is a dramatic swings in the mood depression from hypomania to mania, like that they will have depression to mania, like that within weeks to months. So bipolar disorder has a strong genetic basis. However, environmental factors also play a huge role. Mechanism of action. The mechanism, how does this manic depressive psychosis do develop is the dopamine levels become slightly high during maniac states, which results in secondary homeostasis by downregulation of the dopamine receptors causing depressive phase. The dopamine levels become significantly high during maniac state, which results in secondary homeostasis by downregulation of the dopamine receptors causing depressive phase. Clinical features: bipolar 1, bipolar 2, cyclothymic, mixed episode, rapid cycling. Bipolar 1 is at least one episode of mania and depression. Bipolar 2 is at least one episode of hypomania and depression. Cyclothymic is multiple episode of hypomania and depression for 2 years. Mixed episode is that they have simultaneous occurrence of opposite moods. Rapid cycling is 4 or more mood episodes within 12 months. Within 12 months, if you have a rapid cycling, that is 4 or more mood episodes within 12 months, that is called as rapid cycling. So cyclothymic is multiple episode of mania and depression for 2 years. Mixed episode is they have simultaneous occurrence of two opposite moods. Sorry for the interruption. So okay. Cyclothymic is the multiple episodes of hypomania and depression for 2 years. Mixed episode is simultaneous occurrence of opposite moods. Rapid cycling. Rapid cycling is 4 or more mood episodes within 12 months. So within 12 months, if they have a 4 or more mood episode, that is rapid cycling. Mixed episode is simultaneous occurrence of the opposite mood. Cyclothymic is multiple episode of hypomania and depression for 2 years. At least one episode of hypomania and depression, that is bipolar 2. At least one episode of mania and depression is bipolar 1. During depression, lowered mood, social isolation, increased eating, sleeping, self-regret and low self-esteem. Lowered mood, low self-esteem, social isolation, self-regret and increased sleep and increased eating is associated. Basically, the patient will increase eating, increase sleeping, social isolation, lowered mood, low social esteem and self-regret. During mania period, what happens? The patient will be elevated mood, talkativeness, decreased need of sleep, grandeur plans, high self-esteem. The manic phase lasts for weeks to months, followed by depression which lasts longer. So the manic phase lasts for weeks to months, whereas your depressive phase which lasts for the longer. Okay. What is the management? Management include the hospitalization during the manic phase. Lithium can be given to reduce the manic episodes, risk of the suicide and self-harm. Anti-epileptics can be given like valproate and carbamazepine can be given. Antipsychotics like olanzapine, benzodiazepines used until mood stabilizers start their action. SSRIs are effective for the short-term treatment. However, they trigger maniac episode. Can also give psychotherapy. Cognitive behavioral therapy can also be given. As said, in bipolar disorder, you can give antidepressants. SSRIs is more effective. You can also be mood stabilizers. Various mood stabilizers are there: lithium, valproate, and lamotrigine, which is contraindicated in the pregnancy. Valproate and lithium is contraindicated in the pregnancy, whereas lamotrigine is safest drug that can be given in the pregnancy. So this is about the manic depressive psychosis or a bipolar disorder. Bipolar disorder or a manic depressive psychosis. Before the summary, subscribe to our channel. So what is manic depressive psychosis? Manic depressive psychosis is a character, which is a bipolar disorder where within a week to month duration, a patient will have dramatic mood swings from depression to mania or a hypomania. So mostly genetic, sometimes environmental factors to contribute. What happens as a pathogenesis is in maniac phases, the depression dopamine neurotransmitters in maniac phases, dopamine neurotransmitter is increased in the level. So as a feedback inhibition, what happens is there will be a down regulation of the dopamine receptor that leads to the depression phase. What are the clinical features of bipolar disorder? Can be classified into 5 groups: bipolar 1, bipolar 2, cyclothymic, mixed episode, and rapid cycling. Bipolar 1 is at least one episode of mania and depression. Bipolar 2 is at least one episode of hypomania and depression. Cyclothymic is multiple episode of hypomania and depression for 2 years. Mixed episode is simultaneous occurrence of opposite mood. Rapid cycling is 4 or more episodes within 12 months. During depression, what happens during depression? Lowered mood, social isolation, increased sleeping and eating. During depression, increased sleeping, increased eating, and lowered mood, social isolation, self-regret and low self-esteem. Self to social isolation, increased sleep and increased eating, and lowered mood. During mania period, what happens? Decreased sleep, decreased intake, and elevated mood, talkativeness, socialistic, high self-esteem, high planned, high grandeur plans. And manic phases can be lost for weeks to months, where depression lasts longer than the weeks and months. Management is like hospitalization, and medications like lithium, mood stabilizers like lithium, valproate, lamotrigine can be given. Antiepileptics can be also given, and antipsychotics like olanzapine, clozapine can also be given. Benzodiazepines can be given until the mood stabilizers start their action. SSRIs can also be useful. Fluoxetine, duloxetine, paroxetine can be used. But they also trigger manic episode as a side effect. And psychotherapy, cognitive behavioral therapy can also be used. This is about your manic depressive psychosis or a bipolar disorder. Thank you.